Good morning friends. Today we are going to discuss about H2 receptor antagonist. So what is the importance of H2 receptor antagonist? So histamine binds with the H2 receptors at parietal cells and it helps in secretion of gastric acid or other gastric secretions. So how gastric acid production is regulated? So gastric acid production is regulated by your autonomic nervous system and some hormones. The proton pumps located at the apical membrane of parietal cells are activated by acetylcholine, which is by vagus nerve, histamine as well as gastrin. And this acetylcholine, histamine and gastrin acts via their own receptors. So acetylcholine through muscarinic receptors, histamine through histaminergic receptors, that is H1, H2 receptors, and this gastrin through its own receptors. So these are physiological secretagogues, and out of these three secretagogues, histamine acts through H2 receptors, which plays the dominant role because other two, that is gastrin and acetylcholine, they play partly directly and partly indirectly by releasing histamine from paracrine enterochromatin like cells, that is ECL cells, and these cells are called as histaminocytes, which are located in oxyntric glands. So histamine binds with H2 receptors at parietal cells and stimulates the gastric acid productions. So many a times we hear about the antacids like ranitidine, cimetidine. So these are H2 receptor antagonists. So today we are going to discuss about all these H2 receptor antagonists. What are these H2 receptor antagonists? There are other drugs also which inhibits the gastric acid secretion, like proton pump inhibitors are there, muscarinic receptor antagonists are there, and prostaglandin analogs are there along with H2 receptor antagonist. Okay, so let's see what are H2 receptor antagonists. So there are commonly used four H2 receptor antagonists, that is cimetidine, ranitidine, famotidine, and nizatidine. So we are going to discuss about in brief regarding cimetidine, because cimetidine is a prototype drug of this category, and whatever actions of cimetidine or pharmacological effects of cimetidine are more or less similar to other agents, that is ranitidine, famotidine, and nizatidine. So how to identify or how to remember this H2 receptor antagonist? If we see these agents, the spelling of these agents, cimetidine, ranitidine, uh, nizatidine and famotidine, so there is one thing common, that is tidine. So here in all these you can see tidine is a common, so you can easily remember wherever tidine, that is cimetidine, ranitidine, famotidine and nizatidine are there, they are H2 receptor antagonists. So let's turn to first agent, that is cimetidine. So H2 receptor antagonist, that is cimetidine, ranitidine, nizatidine, and famotidine. So these are the four H2 receptor antagonists. So we'll see one by one. Cimetidine. Cimetidine is the first agent from this category, that is H2 receptor antagonist. If we see structure of cimetidine, the more common thing is imidazole ring, which is common in histamine structure also. Mechanism of action, if we see regarding cimetidine, cimetidine inhibits histamine and H2 receptor activity at parietal cells. And if you inhibit histamine and H2 receptor activity at parietal cells, then the further acid secretion or gastric secretions will be stopped. So it is helpful in reducing gastric acidity. Nature of cimetidine. Cimetidine is hydrophilic in nature. So as it is hydrophilic in nature, it has a limited approach to central nervous system. If we see pharmacological effects of cimetidine, cimetidine reduces gastric acidity or gastric acid and pepsin output. It doesn't have any prokinetic effect. So what is prokinetic effect? Prokinetic effect or prokinetic agents are those agents which helps in forward movement of food or ingesta in the GI tract, and they prevents the backward entry of food into the mouth or esophagus. So they prevent omission as well as they help in faster gastric emptying. So these are the prokinetic agents. So but cimetidine doesn't have any prokinetic effect. Why I am telling this, it is not having prokinetic effect, because other members of this category, that is ranitidine, famotidine and nizatidine, are having prokinetic activity or prokinetic effect. It doesn't have any effect on intrinsic factor. Then it increases prolactin levels and reduces metabolism of estradiol, and it is having weak anti-androgenic effect. So as it increases the prolactin levels and reduces the metabolism of estradiol, it causes the problems like low libido, low sperm count, impotency, and diseases like gynecomastia. So it is very important regarding cimetidine. Pharmacokinetic properties in case of simple stomach animals or human, it can be given by oral route. Orally, it shows rapid absorption and around 95% bioavailability it shows in case of dogs. Half-life of this cimetidine is around 1.3 hours, but it undergo hepatic metabolism. Then side effects, it produces thrombocytopenia in some animals. It has an anti-androgenic effect. It produces gynecomastia, as already told you. Then it produces loss of libido, low sperm count, sometimes impotency may be there. The specific characteristics of this cimetidine, it has having effect on cytochrome P450. It inhibits these enzymes, cytochrome P450. And why this is important? Because cytochrome P450 enzymes are the important thing which helps in the metabolism of substances, drugs, or any xenobiotics. So as cimetidine inhibits cytochrome P450, it affects the metabolism of other drugs. So after administration of cimetidine along with other drugs, the cimetidine may affect the metabolism of other drugs, and there may be retention of other drugs, and sometimes it may cause accumulation of such drugs in the body. Then second thing, after oral administration, it affect the absorption of other drugs, because some drugs require acidic pH for absorption, and as it reduces the uh, acidity, it alters the pH, so there may be effect on absorption of other drugs. Then what are the clinical uses of this cimetidine? Cimetidine is very commonly used for the treatment and prophylaxis of gastric, abomasal and duodenal ulcers in animals. uh, it is also helpful in the treatment of uremic gastritis, esophageal, duodenal, gastric refluxes. So that is esophageal reflux disease, which is very common in humans also. It is helpful in the treatment of hypersecretory conditions due to some gastric tumors, that is gastrinoma and mastocytosis, and helpful in the treatment of equine melanomas. So doses, these are the doses different in different species: dog, cat, cattle, foals and horses. In case of dog and cat, it is 5 to 10 mg per kg, and it can be given by oral, subcutaneous or intramuscular route. That is ranitidine. So if we now see the pharmacological profile or effects of ranitidine, or clinical uses of ranitidine, it is used for similar purpose, that is to reduce the hyperacidity or prevention of gastric acid secretion. The difference is it contains furan ring. Cimetidine was having imidazole ring. Then mechanism of action will remain same, that is they inhibit, ranitidine also inhibits histamine and H2 receptor activity at parietal cells. But ranitidine is more potent than that of cimetidine in reducing the gastric acidity, that is around 5 to 12 times more potent than that of cimetidine. The differential point, another differential point, that is it does not, ranitidine does not have any effect on prolactin, and it doesn't have any anti-androgenic effect. So we already discussed that cimetidine is having anti-androgenic effect. It may produce gynecomastia, it may have effect on sperm count, it may reduce the libido, or sometimes cimetidine produces impotency, but ranitidine doesn't have any such kind of effects. It stimulates gastrointestinal motility, that is it is having prokinetic effect. Now what is prokinetic effect? We already discussed about prokinetic effect. Oral bioavailability of ranitidine is somewhat less than that of cimetidine. Oral bioavailability is only 80%, but in case of cimetidine it was 95%, and half-life of ranitidine is 2.2 hours. Side effects side effects are very rare in case of ranitidine, and also it doesn't have any effect on cytochrome P450 enzymes, so metabolism of other drugs will not get affected. Then clinical uses, similar clinical uses are there for ranitidine for treatment and prophylaxis of gastric, abomasal and duodenal ulcers, uremic gastritis, esophageal and duodenal gastric reflexes, treatment of hypersecretory conditions due to gastrinoma and mastocytosis, equine melanomas. So it can be used for similar purpose. Doses in case of dog and cat, it is 5.5 to 2 mg per kg. The next agent, that is famotidine. If you see difference in famotidine and other two agents, that is cimetidine and ranitidine. Famotidine contains thiazole ring in its structure, whereas ranitidine was having furan ring and cimetidine was having imidazole ring. Another difference regarding famotidine is more potent than the earlier two, that is cimetidine and ranitidine. That is, it is 9 times more potent than that of ranitidine, and 32 times more potent than that of cimetidine. It does not have any effect on metabolism of other drugs because it doesn't have any inhibition property or activity on cytochrome enzymes. Then it is having low prokinetic effect. It shows poor oral absorption, or oral bioavailability is only 37%, whereas ranitidine was having 80% bioavailability and cimetidine was having 95% bioavailability. But famotidine shows minimum first pass effect. It shows rare side effects in animals, does not inhibit cytochrome P450 enzymes, so no effect on metabolism of other drugs. Clinical uses are similar to that of cimetidine, that is treatment and prevention of gastric acidity and gastric or duodenal ulcers. It can be used, but very specific. It is a drug of choice for Zollinger-Ellison syndrome treatment. What is this Zollinger-Ellison syndrome? So this is a gastrin-producing tumor which causes continuous gastric secretions, and it increases gastric acidity. So for treatment of this Zollinger-Ellison syndrome, famotidine is a drug of choice. Then doses 0.5 to 1 mg per kg, oral, IV and intramuscular subcutaneous route in dogs and cats. Then after this, last agent, that is nizatidine. So nizatidine is having thiazole ring like famotidine. It is having prokinetic effect. Side effects are rare, and the clinical uses are similar to that of cimetidine, and doses are 1 to 5 mg per kg. So friends, hope you understand this H2 receptor antagonist and the specific points regarding all these H2 receptor antagonists. You can identify uh, H2 receptor antagonists by their suffix, that is TIDINE in all the agents. Then cimetidine is only having anti-androgenic effect, but it doesn't have any prokinetic effect. Others three are having prokinetic effect and don't have any anti-androgenic effect. Oral absorption of cimetidine is higher, that is 95%, whereas ranitidine is having 80%, famotidine is having 37% oral bioavailability. Cimetidine is having some side effects like thrombocytopenia in some animals, anti-androgenic effect, it produces gynecomastia, loss of libido and low sperm count. But other three reagents are doesn't have any side effects. The side effects are rare. Cimetidine inhibits cytochrome P450 enzyme, so it affects the metabolism of other drugs. But others, that is ranitidine, famotidine, and nizatidine, they doesn't have any effect on cytochrome P450 enzymes, so metabolism of other drugs will not get affected. Clinically, all these drugs are useful in the treatment of gastric ulcers, gastric hyperacidity, or gastric tumors which produces increases gastric secretions, or equine melanomas. It can be used. The only thing is famotidine is more potent than rest of the H2 receptor antagonist. That is, it is 9 times more potent than that of ranitidine and 32 times more potent than that of cimetidine. So this is all about H2 receptor antagonist. Hope you like this. Thank you.